we take calls from people all across the country every day, well, 5 days a week, who, even though the information may be on the internet, exactly what it is that they need to be told, what they want very often is assurance. And so they will call, and I have had some very interesting conversations, and luckily I've been there now long enough to be able to answer some of the questions. I have had really sad stories where a 70-year-old woman had been given herpes by her husband like 10 years before, and she did not understand how it was transmitted, so she would not leave the house. She was afraid she would give people herpes. She was unbelievably sad, and I can't remember what made her finally call, but it was hard for her to believe that, in fact, no ma'am, you're not going to give people herpes from going to a party. And so we have the great fortune, because of course you hope that you help change her life, to be able to talk to lots of people, young, old, all kinds of situations, every day.
In a clinical setting, you may see an adolescent girl come in, one in particular that I'm thinking of most recently that I've interacted with, that it seems every 3 months when she comes in for her depot shot. We also screen her for chlamydia, among other STDs, and it seems like every single time she's positive, despite counseling repeatedly on partner treatment and her lack of using condoms. This particular girl is actually very smart, but has had a lot of trouble with school failure. She, comes from a home where there are pretty unpredictable caregivers. There's not a lot of stable adult supervision, and there's a lot of potentially negative influences in her immediate surrounding in terms of visible prostitution, sort of on a daily basis, a crack house just a block or two away. And I'm not saying that she's involved in either of those two, industries in our particular area, but I think that certainly colors the decisions that she may make in terms of her partner choice or partner availability, as well as the protection that she may use.
My first assignment, or my first position with the Centers for Disease Control, was as a medical epidemiologist in Los Angeles County with the Los Angeles County Department of Public Health, the STD program. And one of the first outbreak investigations we did there was of HIV in the pornography industry. It started with a case with a male. He was an actor and had recently performed in Brazil and had come back and had been tested using traditional testing methods for HIV, but unfortunately the window period was so short between his infection and the test that the test didn't pick up the antibody and was negative. So he continued to perform unknowingly having HIV and infected 4 other women. So that was the first major outbreak that I did there.
It happened, I think, a few months after I moved to Mississippi. I'm the medical director of the STD clinic there, and they called me because there was this almost 80-year-old lady who came to the clinic. And when I saw her, I thought she was lost. I was trying to figure out where she was going, and she told me, well, I have a little problem. And she said she had so what was the problem? She said, I have this vaginal itching. I said, you probably have, atrophic vaginitis, just because of lack of estrogen. So that's what my doctor said, she said. And so you've seen your doctor, so why she prescribed some estrogens, and she was using it. He said, yeah, but I still, so every time she's talking to me, I'm talking to her and bring her out of the door because I really don't see the point for me seeing her. And the third time, because she would say something that we will go back, and the third time I'm taking to the door, she said, well, but I met this guy. And when she said that, she totally caught my attention. I took her back, we sat down, I closed the door. So I said, so what happened? She said, well, I was with my girlfriends celebrating my birthday, and they went to the bathroom at the end, and there was this guy, younger than her, who asked me, what are you guys celebrating? He said, it's my birthday, she said. And he said, well, I have a gift for you if you want to come home with me. And so she did, and her husband had been dead for 10 years. So she went with him, and she said, well, we didn't do anything. He just put his thing in my back, in my behind. So I examined her, and the thing that I think I less expected, and one of the biggest surprises I think in my life as a STD clinician was actually to find out that lady had rectal gonorrhea. And it really taught me a lesson that I try to transmit to all my students and people I work with in terms of not allowing your prejudices, and to affect your judgment as a clinician, because we end up disservicing our patients. I mean, if we don't have it because she insisted so much, I really was willing to take her out of the clinic.
It was working in that STD clinic in the county health department, and the HIV clinic was actually upstairs, separate from the STD clinic, which was downstairs. But every morning I remember coming into that health department and looking in that waiting room and seeing people in the waiting room who were coming in for a diagnosis of STD, trying to get treatment for that, and thinking if in fact HIV is caused by the same behavior that's causing these other problems, the people downstairs will be soon coming upstairs. And it really frightened me, because when I looked at the faces of the people in those waiting rooms, they looked like mine.
I think the field is just as complicated. Our society has gotten even more complicated, and I think we are doing great work in many areas. It's important to recognize that we're at an all-time low for most of our sexually transmitted diseases that we track at CDC are reportable conditions compared to decades earlier, so I think that's something to be very optimistic about. But we also still have a huge burden of infection among special populations, especially young adults and adolescents in our country, as well as men who have sex with men. So we still have a lot of work to do.